Tennessee Commissioner of Health says there is still no timeline for when the certificate of application process or certificate of public advantage process will be complete for the merger of our region's two hospital systems. Tonight, Commissioner of Health Dr. John Dreisner heard from people right here in the Tri-Cities in a public hearing that took about 2 hours to complete on the proposed merger of Mountain States Health Alliance and Wellmont Health System. The merger would put control of all the region's hospitals under one company. To protect the public from any potential harm a monopoly might create, the companies hope to win approval by Tennessee and Virginia health officials, and they promise to abide by state oversight if they win permission to merge. While the deal will have a big impact on the Tri-Cities, only about 50 people showed up at a public hearing tonight in Blountville. Most of them, the overwhelming majority, spoke in favor of the merger, and that included local lawmakers, including State Senator Rusty Crowe, State Representative John Lumberg, State Representative Matthew Hill. It's a move the companies say will improve local health care and keep them from having to merge with an outside company.
I hope that you will approve this COPA. I think you're hearing a repetitive theme here this evening. Thank you very much.
A few did speak out against the proposed merger, saying one company controlling all the hospitals could hurt local healthcare consumers.
Where's the transparency? Where's the honesty? Where's the integrity? And we're expected to trust what they say?
Hearing public comments tonight was the Commissioner of the Tennessee Department of Health, Dr. John Dreisner. He will play a key role in determining whether the merger gets Tennessee approval. News Channel 11 first asked to interview Commissioner Dreisner about 2.5 months ago. The Department of Health denied our request, but said the commissioner eventually would answer questions, and that happened tonight. News Channel 11's Jordan Morrow has more on what he had to say about the future of the deal.
Josh, John Dreisner said when they first scheduled tonight's public hearing, everyone thought the merger application likely would be complete. It's not, but the state decided to move ahead with the hearing anyway. Tonight we had our first opportunity to ask the Commissioner of Health about the decision he'll soon have to make.
Certainly not in a position to make a comment on that. The application is not yet complete and we have not reviewed it.
That's what Commissioner John Dreisner said when we asked if he thought a merger would be a good idea for our region. Right now, neither Tennessee nor Virginia has deemed the healthcare system's COPA application complete. Dreisner says it's up to Mountain States and Wellmont to provide additional information requested by his department. Is there a timeline on them getting that information to you?
The timeline is up to them.
But in the end, Dreisner will be a key player in deciding if the merger is a right move for the region. A region he knows well, having worked here for years, including a time as an adjunct professor at ETSU's College of Public Health.
I know the region well. I think I'm in a very good position to evaluate the COPA on its merits.
The Federal Trade Commission has told Dreisner it has concerns about the merger and the COPA process. His response to our question about that:
I think we heard a lot of really important points this evening in the public hearing, and we'll be taking all of those points and perspectives into consideration.
So what happens next? Commissioner Dreisner said it's really up to both Mountain States and Wellmont as they wait for the information about the merger plan requested by the state on April 28th. Once the application is deemed complete, that starts a 120-day clock during when the application will be reviewed.
News Channel 11's Jordan Moore tonight reporting from our newsroom. Thank you. Commissioner Dreisner said another public hearing is required by the state under newly adopted law once that application is deemed complete.